Assalamualaikum. My name is Muhammad Saifullah Bin Sarudin. Matrix number Bm25110032. Today I will be presenting my special study module focusing on the circulatory system with special emphasis on the hematology. The circulatory system plays a vital role in the maintaining life by transporting the oxygen, nutrient, hormone and removing waste product within the within the system. Hematology is a particularly important as it focuses on the blood and the blood-related disorder. Hematology is a branch of the medicine that deals with the studies of blood-forming organ and blood disease. Blood is essential for oxygen delivery, immune defense, and maintaining homeostasis. Any abnormality in blood components can lead to serious health problems, which highlight the importance of hematology in modern medicine. For my personal idol, I chose the Dr. Muhammad Haris Fadzila bin Abdul Rahman, a respected and experienced hematologist in Malaysia. He has been practicing medicine for over 22 years and is widely known for his expertise in both clinical practice and research. His dedication to patients care and medical advancement inspire me to learn more about this specialty. The Dr. Muhammad Haris completed his MBBS at the University of Sheffield in the United Kingdom in 1998. Later in 2003, he obtained his membership on the Royal College of Physicians in Edinburgh. This strong educational background reflects his commitment to excellence and lifelong learning, which is essential in the rapidly evolving medical field like hematology. Dr. Muhammad Haris specialized in bone marrow aspiration and trephine biopsy, cancer treatment, stem cell transplantation. He is an active member of the professional bodies such as the Malaysian Society of Hematology, Malaysian Society of Transplantation, the Malaysian Medical Council, and the Academy of the Medicine Malaysia. In addition, he has published several medical articles and research papers contributing to evidence based on the medical practices. So I will move on to the anatomy of the blood. So anatomy. Blood is composed of the four main components which are plasma, red blood cell, white blood cell, platelet. Plasma makes the largest portion and acts as a transport medium. Red blood cell carry oxygen, white blood cell fight infection, and platelet are involved in blood clotting. Bone marrow. Blood cells are produced in the bone marrow. Red bone marrow produce all the red blood cells and platelets. Yellow bone marrow mainly store fat but can convert into the red bone marrow during the severe blood loss. This process ensures a continuous supply of the blood cell to meet the body's need. Blood vessel. These are three main types of the blood vessel. Artery carry oxygenated blood away from the heart capillaries, allow exchange of the gases, nutrients, and the waste product. Veins return the oxygenated blood back to the heart. Together, these vessels form an efficient transport network throughout the body. Structure of hemoglobin. Hemoglobin is a protein found in the red blood cell and is composed of two alpha chain and two beta chain. Each chain contains a heme group that bind oxygen. This structure allows hemoglobin to efficiently transport oxygen from the lung to tissue and carbon dioxide back to the lung. Let's move on to the physiology. Let's move on to the physiology of the blood component. Each blood component has specific physiological roles. Plasma, transportation, regulation of the blood temperature and immune protection. Red blood cell, transport respiratory gases and regulate pH. White blood cell, protect the body through immune response. Platelet, maintain hemostasis and vascular integrity. These components work together to maintain the normal body function. Hematopoiesis, which is we call as a physiological process of the blood cell formation. Hematopoiesis mainly occur in the red bone marrow, especially in the adult, such as in the pelvis, ribs, sternum, and vertebra. The process begins with hematopoietic stem cells. These stem cells are very important because they are pluripotent, meaning they can differentiate into all types of the blood cell and also have the ability to self-renew. Next, stem cells develop into the progenitor. Progenitor cells are more specialist and are committed to forming a specific blood cell line such as the red blood cell, white blood cell, or platelet. After that, progenitor cells mature into the precursor cells. Precursor cells undergo several stages of division and maturation before becoming fully functional blood cells. Finally, mature blood cells are released into the bloodstream where they perform their specific function such as oxygen transport, immune defense, and blood clotting. Hemostasis, or we call as the platelet coagulation. Hemostasis is the process that stops bleeding when a blood vessel is injured. So we have four mechanisms of the hemostasis, which are vascular constriction, platelet plug formation, blood clot formation, and fibrinogen formation. This mechanism prevent excessive blood loss while allowing wound healing to occur. So let's move on to number 3, which are biochemistry of hemoglobin. Hemoglobin is involved in oxygen binding, allosteric regulation, carbon dioxide transport, pH regulation, ligand binding, structural stability, genetic variability. So what is the relationship between the hemoglobin and the heme groups? So the relationship between the hemoglobin and the heme group is both structural and also together to form an efficient system for gases transport in the bloodstream. Let's move on to disease. Hemophilia A is a genetic bleeding disorder caused by factor VIII deficiency. Patients experience prolonged bleeding after injuries, surgeries, or dental procedures, as well as delayed wound healing. What is the symptoms of the hemophilia A? The common symptoms include frequent nosebleeds, bleeding gums, swollen and stiff joints, easy bruising, coughing or vomiting blood, blood in urine or stool, heavy menstrual bleeding. If untreated, repeated bleeding can lead to joint damage and disability. So, what is causes of hemophilia A? Hemophilia A is caused by a mutation in the factor VIII gene on the X chromosome. As a result, the disease mainly affects male, while female are usually carrier. In about one-third of cases, the mutation occurs spontaneously without any family history. So let's move on to the technology. One of the latest treatments for hemophilia A is emicizumab, a subcutaneous monoclonal antibody therapy. What is the advantages? So the advantages include it helps prevent bleeding episodes, effective even in patients with factor VIII inhibitor, easy administration, less frequent dosing, long duration of action, improve quality of life. So, in conclusion, hematology plays a crucial role in the circulatory system by ensuring efficient blood function, immunity, and clothing. Thank you for your attention. That is the end of my presentation. Bye.